The first and probably the most commonly used technique in dentistry to maintain a dry field is the cotton roll. You probably would have seen it if you're a patient at a dental practice. Basically it's a compressed roll of cotton wool and it's used to place beside the tooth or around the tooth to absorb the moisture, and it also provides some soft tissue retraction. So it sort of pushes the soft tissues away from the tooth surface. So that improves visibility and also safety. It moves the soft tissues away from the cutting devices. Like every technique in tooth isolation, there are pros and cons. The advantages of the cotton rolls are that they're cheap. They take little time to place. Patient acceptance is generally good, unless of course you attempt to place the cotton rolls in this way, and that might be a little unacceptable. And as I said before, they do retract soft tissues to some extent, but they're not completely successful if we're looking for soft tissue retraction. You can see the disadvantages seem to outweigh the advantages here. Let's just go through those. They do not isolate the tooth completely. There will be contamination from the breath, for example, from the mouth. So whilst they might remove or eliminate most of the moisture from the field of operation, they certainly do not completely isolate the tooth. And for some techniques in dentistry, we want to completely isolate the tooth and to eliminate humidity or moisture as much as we possibly can. They do not protect the airway, and when we look at rubber dam, you'll see, I'll explain to you what I mean by protecting the airway. They sit around the tooth, and I'll show you a picture in a moment. They will protect the general localized area, but they won't prevent from the patient accidentally aspirating or swallowing as a result. Some of the other techniques do that. If you wash the tooth, and you know already that you have to wash teeth to remove things like etch and other materials, then the cotton roll will become saturated and will need to be replaced. Okay, so there's a constant replacing of cotton roll during a procedure, which is a disadvantage. It's also easy for the patient to close their mouth. And for some procedures we actually want to assist the patient to keep their mouth open for long periods of time. This particular type of tooth isolation doesn't assist with that. It's also very difficult to use in the cheek, particularly in the upper teeth for very young children. There's not much room in there, so when you try to place this beside the tooth, they open their mouth wide, the cotton roll slips down. So quite significant disadvantages. Having said that though, they can be used effectively in some circumstances. This is a cotton pad which has been used in the cheek to eliminate some of the problems associated with the bulk of the cotton roll. So here you can see some cotton rolls in position on the lingual, the tongue side of the tooth, and also on the cheek side of the tooth, the buccal side of the tooth. Now, there's also a device being used here to hold the cotton rolls. This is called Garmer's clamp, and the clamp is designed to have two cotton rolls sitting on either side on these little prongs. It's placed in the mouth and kept secure under the chin with this little device here. So that sitting in place in the patient's mouth isolates the row of teeth from the saliva from both the cheek side and the tongue side. It also provides a certain degree of soft tissue retraction, so the tongue is pushed away from the field of operation and the cheek is pushed away on this side. It can be used effectively for fissure sealants and posterior teeth, but if you're using a resin-based sealant, you really do need very good moisture control, and that's difficult to achieve even with the Garmer's clamps. If you do use Garmer's clamps to place resins, you have to have a very highly skilled dental assistant working with you with some suction to remove further moisture from the cotton rolls themselves. And one of the disadvantages with this particular device is it can't be used in the upper arch. And when we have a play around with these, you'll see why. So the Garmer's clamps are designed, this is right and a left, so there's one for the right side, one for the left hand side of the mouth, and they can only be used in the lower part of the mouth. You can also get adult size or baby size as well. And the baby size you may need to trim the cotton roll in half or reduce it so that it fits into the smaller mouth.